WBRZ News 2 at 4. Dr. Anthony Stevens is here talking about the physical changes smoking does to the body. So the before and after pictures are pretty dramatic here.
Oh, yes. You know, there was a recent study, I think we showed this a few years ago, but about identical twins that they compared who smoked and who didn't smoke. And it was really looking at facial aging, especially around the eyes and the lips, and we found significant differences in those that had smoked and those that had stopped smoking, but you know, for maybe 5 or 6 years. And so it continues on. It's a big problem, and they're targeting now, as we've talked about, you know, teens, and so they're actually showing what teens and how the facial aging, how it changes them, and so we're hoping that this will affect teens and stop them from smoking. Actually,
so what do we have here? Oh, this is part of the video from the Centers for Disease Control, the health organizations that are releasing the scare tactics videos to show people the different types of risks, and we've seen this on TV before, but it is pretty dramatic.
Very dramatic, and again, you know, why don't we target where it starts at some of the teens, because most smokers have started at age 18, and so if you can target the younger folks, perhaps we can have an impact on later what happens to them, and especially, you know, facial aging seems to be one of those motivating factors which affects teens.
What kind of clients do you see come in with problems
with
like
problems with smoking? Well, not only facial aging, but it also is wound healing. And so if we're going to operate on people who smoke, we can expect wound healing. And we're here again, we can see pictures of the twins that smoke. The gentleman on the right, you can see a difference in his facial, in his eyes, around the nose and nasolabial folds of the one that smoked and the ones that didn't smoke. And so it affects them in a significant way. And the lady on the left, you can see it's very different with the lip lines and around the nasolabial folds. And these were standardized pictures that were taken a few years ago, which dramatically shows the effects that smoking can have on the face.
Absolutely.
No question about it.
So what sort of options are there out there for treatment?
For treatment, number one, we recommend that they see their medical doctor, and there's some other avenues that they can do to stop smoking, but most people will just tell you that it's cold turkey is probably the best thing.
Okay.
And so after 2 weeks, we'll potentially operate on, but they need to stop at least 2 weeks and possibly longer before we can do surgery on them without significant risk of wound healing issues, especially when we talk about plastic surgery, moving parts around, which we have devascularized vascular tissue. So it's very important that they do stop before we ever smoke, and facial aging is one of those things that
Absolutely.
is, you know, you cannot deny some of those pictures.
Absolutely. Dr. Anthony Stevens, thank you so much. We'll be right back.